two conditions, two alternatives. Either we go back to London or you divorce. So the husband preferred not to divorce her, and they came back to London, but he told her, you must go and get a therapy course. She came to our hospital in London, and I took her for treatment. But how can I convince a cockroach to come gradually? Of course, I started with imagination first until we reached the high point in the hierarchy. But then I bring a small dead cockroach far away. She gets used to see so and so. She comes near and near. But now I want a live cockroach. How can I bring a cockroach and convince the cockroach to come gradually, or I force him to run around but not to come towards her? Think about the possibility. What shall I do, or what did I do? It is up to you to give me a suggestion. Don't be afraid to give a suggestion, even if it looks upset. What I want a cockroach to go around, just like in the natural world, to run like this, and for her to see, and not to run away. I'm giving you this example to know that it is the job of the therapist to become creative, to think about something. You know what I did with this woman? I brought a very large white paper that I put on the floor. And in this large paper, I bring an electron jelly. You know what is an electron jelly? When they want to give to someone an electroconvulsive therapy, there is jelly. It's just like jelly with salt in it to pass the electricity. They take a little bit, put it like this, and then put it on the head, so that the patient, the electricity will pass from the instrument to the head of the patient without becoming hot and burning. So they put this jelly, and the jelly has salt in it, so it passes the electricity. Now I took the electrode jelly. I put the paper like this. Very large paper. Here is the application. Okay. And then I call the electric jelly like this. all of this electron is jelly. Just like jelly sweet, but a bit softer. And the cockroach is here. So she's looking at the cockroach, but the cockroach moves around, runs this way, it finds the jelly, it cannot go over the wall. So it comes back, it goes here, it comes back, it runs around like this. Then I bring this paper a bit nearer. Just like the case of the rabbit with the little oil. Nearer and nearer and nearer, and then I take her back to lie down like this, to relax, and then we imagine ourselves holding a dead cockroach, dead small cockroach. I will make her imagine this is me here. Imagine a dead cockroach, small dead cockroach. She's looking at it. Now she can touch it. Imagination. After then, practically we go here. Then, imagine a cockroach, tiny live cockroach, running on your hand. She could imagine this without anxiety. Then, a bigger cockroach. And the woman, strange enough, was able, when we came the last session with the psychiatrist and everybody coming, in the last word round, and we brought her, then she was able, because after that, I gave her a glass jar with a cockroach in it, and she was holding the jar. Then she was able to let the cockroach roll on her hand. She was unlike any normal human. She was not only fully cured, but she became exceptional. Now, this is another case that I can tell you. Other cases, because these are not Muslim, I will give you an example, living example of a case of a phobia, social phobia, social anxiety, fear of people, of a Saudi, he's a Saudi soldier. In all my career, I have not seen a man who is afraid of other men like this man. He is a soldier, and at that time in Saudi Arabia, people will not be, their salary will not be sent to the bank. They will have to come to the cashier and receive their salary in cash. The cashier discovered that this man is a coward, and all the time he gives him his salary and he takes out from it 50 riyals, 100 riyals. And other people are waiting to get their salary. So he is afraid, he just takes his salary and goes. He knows it is less, but he cannot say to the cashier, you cheated me, this is not my salary, you took some part of it. Then he came, I was then in Taif, in Saudi Arabia, in the psychiatric hospital there. When we came in and we all examined the case, the psychiatrist said this man has a mental schizophrenia. He's schizophrenic. He needs to be treated by drugs. I said, no, this is a severe phobia, and I will try to help, I can try to help. We argue this or that. The head of the hospital was the famous Saudi psychiatrist who made psychiatry as a profession in Saudi Arabia. He was very tough. And even doctors are afraid of him. So he said, okay, we should solve this issue. What do you think, Malik? I said, you give me the patient, and I try my therapy on him. If he improves, I am right. If he does not improve, I will give him back to you to pump drugs over him, or to give him electroconvulsive therapy, or do whatever you want. Okay, they agreed. Then I took the patients and I tried to build a hive. You are sleeping in the afternoon in your house, the first item. And then children are playing football in front of your house. In Saudi Arabia, children play football in the road at that time, in the street. And they shout and play football. Now, I would like you to come out now and to speak harshly to them. Don't be afraid. These are kids. Tell them, you terrible kids, what are you doing? I have been asleep, you wake me up from my siesta. Go and play somewhere else. Then he repeats this again, and just like the Moroccan woman. Then we go higher, and we also, I use role playing, until we reach the point where he can go into a taxi and have an argument with the taxi, how much money to pay. Before coming to the hospital, he would also be ashamed from if he wants to buy some cloth material for a garment, he goes in, and then the people who are selling material, they are very good. They bring down things from the shelf. Oh, this cloth is good for you. So, particularly if there are women in the shop, he cannot say no. He said to me, I often buy material which I throw away because I cannot say no. Okay, we went through the highway bit by bit until he was able to go out, take a taxi, go down, and then tell the taxi man they do not agree, they don't have these meters. No, this much no, and he fought with him and forced the taxi man to take much less than what he wanted to keep him with the money. He came back to me in the hospital. He was so elated that he had been able to do this. Then again, we go and tell him, I tell him while he's relaxed, I believe the spirit you are in. Do you think this soul you have, it belongs to you? Do you own your soul? This soul belongs to Allah. And you don't have the right to humiliate your soul. This is very important. Then after a while, this man was able to go through until he was able to go to the head of the hospital, who is everybody is afraid of him. His name is Usama. He goes, Usama, can I use your telephone? Then Usama was terrified. Yes, go ahead. This Bedouin took the telephone and spoke for half an hour, and Usama looking at him like. Then Usama called me. Khalas ya Malik, we are convinced. Don't treat him anymore. It is enough. Let him go. Now, these are hierarchies that you can invent. I will give you a fair one for which I failed to develop a hierarchy. A Lebanese woman in Riyadh, her husband brought her to me because she has a terrible fear of ghosts, of Hantu, to the extent that she stays in the balcony. When her husband goes to work, she stays in the balcony. She can't get into the room. And she waits for her husband in the balcony until he comes back. What hierarchy can I use? Can you tell the Hantu, Mr. Hantu, please, I want you to come graduate this way? There is no way for me to make a hierarchy. The best thing is to talk here cognitive therapy, spiritual therapy. What is that? He can't do anything. He cannot. The Hantu is afraid of you more than you are afraid of him. If you remember Allah and mention His name, you shouldn't be afraid. All of this is in your mind. But then I could not treat her fully. So what shall I do? Shall I say this is a failure? Perhaps I did that. Because here we do not only need cognitive therapy, and we need a religious therapy. What did I do to help her? What do you think I did? She was finally cured. She became okay. But how? Nobody will tell me how. Yet,
thank you, Mr. Ibrahim. This is what I have experienced. My son, who is afraid of hantu, when he don't want to go to the toilet alone, or he don't want to go to the kitchen alone because afraid of hantu. Then I said, do you have been seeing hantu? No. So, tell me, if yes, tell me how. How is the shape of hantu? What is the shape of hantu? No, I never been seen of hantu. So, okay, now you can go. No, I'm not. I'm afraid. Go with me to the kitchen or to the toilet. Okay, the next time you go alone there, if you find hantu, just shout, call me. I will come to you immediately. This is that I did to my son. So once, no problem, because there is no hantu actually. Okay, and then tomorrow I just repeat the same thing, and now Alhamdulillah.
You got over.
Yeah. Thank you.
This is a very good way. So he also, again, there is the opposite kind of thing. You are safe, if you call me, I will come. So he feels, and this is a little boy, so you need to do it. But this Lebanese woman, her husband cannot tell her, go into the room, and if you see a hand, because this is a child. He will know, he will believe that a hantu, if he appears, I will call mommy and she will come and try to move away. Khalas, he's convinced. It's a child. But this other woman, it is not easy to make this approach to her. If her husband tells her, get into the room, she knows that too cannot be seen, but it can affect her. I will tell you what I did. And she was killed. But it is not me who really helped her. I asked for a well-known sheikh in New York who can treat such cases. And then I referred the woman to the sheikh. And the sheikh read ayat over her. He is a professional traditional healer, Islamic healer. And he read something in water, then had shower with this water. And then he told her, let her ayat of the Quran and things to show her that, and who has no power over her. Then she was cured. So here I want to tell you that cognitive behavior therapy may fail in some cases. And accordingly, you will have to change. Now what I am teaching you now is pure behavior therapy. But I mixed it up with cognitive therapy. But at times, you only need cognitive therapy alone. Changing the thought of the patient, changing his belief, may very quickly improve his case. The patient I told you about of Morocco, one of the best things that helped her to go through the therapy is to change her belief about Allah subhanahu wa ta'ala. She felt she's bad. She felt she's guilty. She had depression. She had the tick of her mouth. She had the phobia of blood. All of them, these symptoms. And she feels Allah has taken away mercy from her because she accepted to have she was forced into sexual relation with her boss. The ayah of the Quran that I read to her was an important element in her treatment. It is a beautiful ayah in Surah Al-Imran that speak about Allah has prepared a paradise as large as the earth and the heavens for those who spend when they are rich and when they are poor, and who, if they do a fahisha, if they do something sexual or something bad, a big sin, they remember Allah and ask for forgiveness. I say to her, what have you done? You were forced into this relation. You are not a woman who is running like this after me. No. You were forced. And once you have done this again and again, Allah now forgives you. And there is a beautiful verse in the Quran that says, don't force your girls into prostitution. But if you force them, then remember that Allah is all forgiving. He will forgive the girl who has been forced, and will forgive the man who forced her into prostitution if they make tawbah. This is very important. This is at times cognitive behavior therapy in which you only change the belief of the person is enough to make him better in a very short time. Okay. Shall we open go for the discussion?
Terus dilanjutkan, maybe any question to clarify some point before we continue.